Safety Awareness Week is a really important week for us in the organization as we try to promote patient safety across all of our organizations. The reason it's important is that it really provides a single week where we can focus on patient safety topics and increase staff awareness about what patient safety is, why it's important, what are the issues that are facing us today, and we can really do education to the staff and also let the staff meet some of the key safety personnel in the hospital who are trying to improve care. They can ask questions, they can be updated on current initiatives, and then I think the other part of it is it's fun. So usually our hospitals do raffles or activities related to safety that the staff can engage in, have a little fun, maybe get a prize, but it just also kind of creates that that culture where people start to feel more comfortable talking about safety and understanding what some of the big issues are that we all need to work on.
Even though Patient Safety Awareness Week reminds us for 7 days the importance of continuing our efforts 365 days a year and committing to that, the ongoing efforts for patient safety have actually accelerated, I think, in the last couple of years. We recognize that we have a lot more work to do. We've come a long way, baby, as the old expression goes, but there's a lot more work to do in the future to keep our patients safe. Serious safety events continue to happen, and we have to build in new systems and new processes and examine what isn't working so that the care delivery system that we all work in or we all interact with, can keep our patients safe. I think one of the biggest challenges we have ahead of us is to look at patient safety in venues and areas other than the classic inpatient hospital setting, because patient safety issues occur in offices, physician offices or nurse practitioner offices. It occurs in ambulatory clinics. So it's important for us to examine patient safety across the continuum of care. I think that's the next frontier.
Most people in healthcare, the majority, are doing the best they can within the systems they work, but not every system's safe. And they should be aware that even in the best of circumstances or the safest systems, that things can still go wrong because the medicine is not a perfect science. And I don't think the patients and families that haven't been touched by medical error really understand that yet. I believe that patients can only be involved as they want to be. There are some patients, I'll give an example of my grandfather, who really wants nothing to do with being involved. He wants the doctor to tell him what to do and he will follow the exact instructions. And there are many patients like that. So I think it's really about patients being involved to the level that they're able to. For me, I want to know what medications, I want to know why I'm taking them, I want to know why they're sending me to a certain specialist. I am learning to ask, how's your infection rate when it comes after having MRSA, learning to ask those difficult questions, being aware of clinicians washing their hands now. I think we should encourage patients to ask, clinicians to wash their hands, and we should also have clinicians be more ready for that kind of environment where patients can ask and they won't be offended. There are many things. Take your medication list with you. And again, the healthcare community has to be willing to, if patients are told to take their medication list when they come in with it, they have to actually use it.
I think 7365 is a great theme because as much as the hospital quality and safety folks want to improve patient safety, it really can't be done unless every single person in the hospital is working on patient safety. And so to me, patient safety starts at the front lines, and it's every person's job to work on patient safety. So yes, Patient Safety Awareness Week is a great time to draw focus to that, but I think the message really needs to be that this is not just something that happens 1 week out of the year, but it happens all day, every day, in everyone's job to make sure that we have safe care.